Relax this shoulder. Hello, I am Dr. Leilani with Complete Connection Chiropractic here in Ames, Iowa, and today we have Kassidy here. Kassidy has been experiencing quite a few headaches just from her daily activities. She works full-time. She also is a mom, so she's always carrying a little one around. And just with her activities, like I had mentioned, we do develop a lot of that stress in her upper neck and back. So today we're gonna get her adjusted. So we're gonna go face down here, please. Okay, so with an adjustment, with every single person that walks in the door, we are looking at just tone of muscles, how we're feeling. So I'm noticing she's got quite a bit more tension going on, even just down here in her left side. We look at her leg length. She's pretty even, but if we bend the knees, I'm looking for evenness here. She's a little shorter on her right side. If we come forward, she isn't wanting to come as far on this right side towards her hips, which tells me we've got something going on in her pelvis. So like I mentioned, I am feeling for tone. When we've got areas that aren't moving as well as they should, different tones pop up in our musculature. And right in here is where I'm feeling a lot of tension. This area is very, very common in women, especially right along that bra line. This area, and then right at the base of your neck, and then the top of your shoulders here. Very, very common area. I like to start off with a nice stretch. This crossbody action is very, very hard to do yourself. So I just like to give you a little bit of love, and you should feel a nice stretch in your low back here. I'm also just feeling for how well her body is moving. You've got all of these joints in your spine and also in your ribs that attach to your spine, and everything should be moving pretty well. But right in here, like I had mentioned, is where I'm feeling it the most. So I'm gonna have Cassie take a nice deep breath in, just relax all the way out, little pressure. Good. I'm also looking for some hunching going on. And so a lot of times if we have a curve in the spine, like I mentioned, those ribs are attached to your spine. So if we've got a curve going on, it's gonna alter the way that our ribs are presenting. And she's got a little bit going on this right side. So we're gonna pull tissue this way and have you take another deep breath in, all the way out, little pressure, good. And everything moved well. Okay, so in her pelvis, when I brought her feet up, her right side was not coming as far forward as her left. So that's telling me we've got issues with how her right side of her pelvis is moving. So I'm gonna have her face this way up. And I'll have her bend this right leg. We're gonna bring that bottom hip forward for me. Good. And just give yourself a nice hug. Good. This area will lock out her pelvis. I'm gonna move because we've got everything locked out. Good. Okay, so for her specifically, she works at a desk, so she's on the computer quite a lot. Posture-wise, what we find is we aren't thinking about it while we're working throughout our day. So our head comes forward, and it pulls on all of these muscles in our upper back and neck, causing a lot of tension. We get headaches. How many headaches would you say you have had in a week, like in the past?
As many as like 3, maybe 4.
Okay, and since starting chiropractic care, has that decreased? Has it stayed the same?
It's decreased quite a bit.
Okay, lovely. And that's what we want. We want to take away that stress that's happening on the backside of our muscles here, just so that you're able to do the things that you want to do throughout your life. Okay, we're going to start right in. Okay, relax this shoulder. Good. Last thing I'm gonna check here is her first rib. Your first rib lives in between that little hollow between your collarbone and your shoulder. When we're working at a desk, what happens is we bring our shoulders up if we're typing a lot of the time that we don't really realize. And then that first rib comes up with it. A lot of times this can present itself with like radiating pain up into your neck, or even sometimes some discomfort right behind your shoulder blade, right? And so we just kind of assess right in this area. Are you tender more on this right side?
Yeah.
Yeah. So I'm gonna have you bring your left hand to your right shoulder. Yes, perfect. And then you're gonna bring this arm around my back, and you're just gonna relax as much as you can on my back. Take a nice deep breath in, get my hair out of the way. Take a deep breath in, all the way out. Good. Good. Beautiful. Okay, come on up. And we're gonna recheck. So we'll straighten her out here. We are even. We're gonna bend at the knees. We're way even now. That's great. And if we come forward, we're coming forward evenly. Love it. That's exactly what we want. Move around. See how we're feeling.
I feel like a loosey-goosey.
A lot of people say they feel lighter, a little looser, less tension, and that's exactly what we want. So typically with our patients, we give quite a few exercises to do at home or even at work when we're starting to feel that tension creep Simply into a chin tuck. But we're not bringing our chin down. We're gonna bring our chin back, okay? So bringing our chin down is essentially that position that's giving us all that tension. So that's not what we're gonna wanna do. Give yourself 20 chins, then you're doing it right, okay? So if we're gonna bring our chin straight back, we're gonna go this way and relax. We call them funky chickens because if we hold this position, our neck muscles will get pretty tired. We're gonna go back and forth. So we'll stay neutral, bring our ears in line with our shoulders by bringing our chin straight back, relax, back, and relax. Okay, our second stretch that I recommend to a lot of our patients is doing the exact opposite of what we're doing for long periods of time throughout the day. We'll externally rotate our arms. So we're gonna go palms up. We're gonna open up our chest, bring our shoulders back and down, and look up. So you'll feel a really nice stretch across our chest here and into our neck. And then we're gonna relax. So again, we're gonna externally rotate our arms, bring our shoulders down and back, open up our chest and look up. So the last stretch of today is going to be pretty similar to the previous stretch we just did. It's going to have a lot to do with opening up our chest and getting some rotation in our upper back. Go onto all fours. You're gonna go on hands and knees here, and you can sit back on your heels. Left hand to the back side of your head. Push down into the ground with your right arm. And then open up your chest and look up at the ceiling. You're gonna bring your elbow to your other elbow. So we're gonna cross down and just open up and look up at the ceiling. Make sure you're pushing down with your right hand. We're not letting our shoulder come down like this. We're gonna open up, push, and stay stabilized in that shoulder. And then come down across. Beautiful, and we're gonna do both sides. Awesome, well that's what a typical session looks like with us, with someone who is experiencing upper back pain and tension headaches. So if you're someone who is suffering or maybe feeling overwhelmed with headaches and it's taking over your life, know that you don't have to suffer any longer. We've helped over hundreds of people not only get rid of upper back pain and headaches, but improve their quality of life. Here at Complete Connection Chiropractic, we have developed and formulated a unique and effective approach where we are getting to the root cause of why we are having this pain and dysfunction rather than slapping on a Band-Aid and having a cookie cutter approach for every single person so that you can get back to doing the things that you love. So if you're ready to get to the root cause of your pain and limitation, go ahead and click the link below for our special, for our consult and exam. It's over 60% off. Let's get you back to feeling like yourself again. Click the link below and we'll see you on the inside.